Hi everyone. I'm not going to keep track of day numbers anymore at the top of my head because I can't remember, but I know today is Friday. Wait, I think it's Friday. Yes, it's Friday. Today's day Friday, and I'm 5 weeks out now. So I guess I should be moving into week numbers instead of day numbers. I'll still keep it days on the as descriptions, but I'm not going to remember when I started videotaping. I just know I'm at 5 weeks. I know that because I went to the plastic surgeons today unexpectedly because of an incident yesterday, which was like something that people do all the time, and it was just dumb. And anyway, so today, I know like for you I'm just wearing black, but I had nice shoes on today. I had my nice jeans on. I got a new shirt that my friend sent me. Like, isn't this cool on the sleeves? It's like short sleeved. I have this mystery thing on my arm here. I don't know what the heck that is. I asked the doctor, like, what the heck that is. There's so many things that have a risk of blood clot, and I'm like, how do you even know if you have a blood clot? I don't know. I have actually been reading and Googling and YouTubing a lot more than I usually do. I'm in pain right now, by the way. But I can't possibly Google all the stuff that I'm supposed to look up. And yes, that is Battery Park behind me, in case you're wondering. So today, as of Friday, was supposed to be a normal day, like a normal day. I made an appointment to get my glasses fixed. They're not fixed. They're like sticking into my ear on the left side, and they had to get adjusted. And then my friend said, do you want to go out for breakfast beforehand? And I'm like, oh, I just got asked out on a date, like a friend date. But still, like, I haven't been asked to do anything social. Well, definitely in at least 5 weeks. People wanted to do stuff with me before surgery, but no one's asked to do anything with me after surgery. It's all been about, like, taking me to doctor's appointments or going walking with me, which was fine. But I wanted to do something that was, like, normal. So I'm like, yay, I got asked out. Weirdly, I got asked out by her, and I'm like, yay! And then strangely, I was asked out on a dating app, not by the person that I made that. Did I talk about that with you guys or not? Someone reached out on a dating app and said, hi, Tiffany, blah, blah. And I'm like, my name's not Tiffany. And my sarcasm really came out. But yeah, I was asked out on a dinner date with someone from Match. I don't want to date anyone from Match. I have other reasons why. And I also don't like meet someone for a first date for dinner. It's too much time to spend with somebody that you don't know if you're going to click with or not. And it's like too soon. I know nothing about him, and nothing that he's said has enticed me to want to go for a meal with him. And then I'm like, I don't even have a car to go out, you know, with someone. And I'm not being my normal charismatic self. Normally, if I were driving, I'd be like, all right, whatever, you know, totally on my terms, but I'm just like zero in dating mode right now. I've been dating myself for a good, like, like year and a half or so. It's been great. It's been a great relationship. We're really hitting it off and learning a lot about each other. But I'm dilly-dallying. Let me explain to you what happened. So I went for breakfast this morning, and it was nice. Nobody else was in there, sitting at least. So COVID-wise, I felt comfortable. And the woman who owns the place where I went, I haven't seen her in a long time. I have a mosquito bite. So it was nice of the normalcy of walking into a coffee shop where you know the owner, and she's so happy to see you. And the person who's just leaving and checking out, I also know. And I know a lot of people in town, and I recognized her. I mean, everyone still has masks on, but I recognized her hair, and I knew immediately who she was. So it felt normal because that happens to me a lot in town, mostly, I guess, from anchoring the news, and I volunteered for quite a bit of stuff. So it's nice to hear that, or it's nice to see people, and she made a comment about how, like, what I'm doing is impacting so many people, and which is just nice to hear. You know, I don't do this just for my own therapy, I guess, and I'm getting great feedback from other people that this is helping other people, which is, you know, half of what I want from doing these vlogs, because the other half is helping me. And today, it's very much about helping me. So we were supposed to have breakfast and then go get my glasses adjusted, which is like a normal kind of doctor-y appointment to have. But last night, I've said this before, I don't have the best nighttime habits. But last night I made a great decision to, I was going to put up another vlog because I'm like almost a week behind now. And I'm like, you know what? I'm not going to do that because I know I have to get up early. And I put the clipboard away and I'm like, I'm just going to like scroll through. I was thinking, I was watching my own video. That's what I was doing. I was watching the video of Neighbors to Know that I posted yesterday. I downloaded it from Bedford TV's stuff and put it up on Neighbors to Know. And I was watching the episode of my life. And I just found it interesting because I'm like, that's me. And that's where I was 3 weeks ago. And like, wow, how much has changed in 3 weeks. Because I don't have the drains anymore. I mean, for a billion reasons, but I don't have the drains anymore. I had all 4 drains at that point. And yeah, so if you, I mean, I don't know, I don't remember what day it was on this vlog, but if you go to Neighbors to Know on YouTube, it's the last video that's up there. Paul Whitman and Katie Duvall from Bedford TV put it together. Paul's done a few of my other shows before too, and he did a great job like pulling it all together. And anyway, so I was watching that, doing a very typical thing that a lot of people do. I'm laying in my bed and I was holding my phone. I have a pop socket. I was holding my phone with my right hand propped up on my pillow and just watching. It was actually off to the side and was watching. I'm sure you can see where this is going. And watching the video. I didn't plan on watching the whole thing. I just thought I'd watch a little of it and then like conk out and go to sleep. And before I go to bed every night, I've been spending some time without a shirt on, without my bra on, to have become more comfortable with my body, with having nothing there. I can't see a lot from the top down. I really see everything if I'm looking head on in the mirror, but it's also to get sensation back. So I just kind of, I feel like I should have moved this further back. Ow. I just kind of, I just like touch around and like here, well, now I'm hypersensitive, so I won't use this side. I'm sure you can guess why. So like here, you know, I can feel up to a certain point, and then like here-ish, well, on black, I can't really tell, my boob ends here. Here-ish, it starts to go numb. And I want to spend time just touching around to just, you know, revigorate things, to regain feeling in every part of my breast. Whether they say it's possible or not, I truly think that if I do those, and it's not hogwash. I brought it up to the nurse at the plastic surgeons today, too, that like that's a good thing, and eventually, not yet, you can actually do massage work with your, I just poked, with your breast in order to, you know, get stuff going again, where you make those connections and you can start having sensation. I have sensation on this breast right now. It's almost like behind. It's more like my chest wall, not my actual boob, because that's all numb. So what I did, put 2 and 2 together. What I did was I was watching the thing and I must have fallen asleep, because the next thing I knew, it was like boom, and my phone had fallen from my hand onto my boob. And my phone, like I bought a, you know, fancy ass iPhone about a year ago, I guess. And I bought one of those like hardcore, it's not an OtterBox case, it's an Armor or something case, but it's pretty thick because I didn't want to like drop it and crack it. So my phone is pretty heavy. So my phone fell right here. Actually, I'm gonna get this backed up so I can give you a little picture of what I did. So the phone, although on black you can't tell, but like here's where my boob ends. Should I keep going further out? That hurts a little. So Yeah, so here's where my boob ends. The phone fell, like, I guess pretty much straight across. So I could feel the top corner, you know, picture a rectangle. I could feel the top corner clearly. That's what woke me up, because I was like, ow. But here is all numb. So I didn't think anything of it because I'm like, it's numb. And I'm like, like, did I do anything? You know, it went flat on it. So it's not like I did anything to the stitches or anything. But I felt around to see if I screwed up anything. And when I got, like, here's the bottom of my breast. When I got to the bottom here, I was feeling along and I feel this bump sticking out here. And I'm like, shit, like, what did I do? That wasn't the word I used, but I'm not saying the word I used. I felt a bump sticking out. And I was leaning back, like, in bed. So I was at, like, my 45-degree beach chair angle. Because it feels different. I mean, right now I have a bit of padding on, so I can't feel it, but I was laying back, and when I laid back, it was more distinct. When I sit up more, I feel it less. So I freaked. This was at, like, I don't know, 3 a.m. or something stupid. And to me, it felt like it was the implant itself. And I don't know, like, exactly where everything is. And I know they've explained it to me a million times, but I can't, like, physically picture how it's all put together. You know, they've explained it to me before. To me, like, when he showed me the implant itself, like, in his office, and he explained that it was round, and, you know, there's silicone inside. So he said, when we were talking about whether to put the implant on top of your pectoral muscle or underneath it, he said when it's on top and it, you know, you're standing straight up, sometimes, like, obviously the silicone moves down a little bit, so you can see some rippling in the top sometimes. So that's, like, one of the cons of having it on the top of your pectoral muscle. For me, there were more cons having it behind my pectoral. And honestly, right now I'm tired and don't even remember what they all are. But that's what it felt like to me when I was leaning back. It was almost like it was a ripple of the bottom of the implant, and I could move it. I could move it. Like, if I poked at it with my finger again, it's numb. I don't know a good analogy. Like, it's numb, but I can feel, like, this thing there. And to me, it felt like if I take a side view for a minute, to me it felt like if here's the cup where my boob is, and, like, there's a tray or something here, it felt like my implant just, like, popped over the tray. And I'm like, well, maybe if I just go, like, boop, 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 I can tuck it back in again. And I don't think that it's actually made. But I didn't freak out too much because I know that I can overreact. So I'm like, I'm not going to be totally reactive. And, you know, let's just whatever. And I was so tired. And I'm like, there's nothing I can do about it now. It's not something that would need, like, an ER visit. You know, I'm not in that much pain. It just hurt. But I'm like, the thing when your breasts are numb is, like, even if you are in pain, you wouldn't really know it because your boobs are numb. And, like, hours later, I took Tylenol a couple of hours ago because it started to hurt, like, under. So when I sat up, I could still feel it, and it was, like, just popping down a little bit. So I still went to get breakfast. I called the office as soon as they opened, left a message. They called me back while I was at breakfast, and they said, can you come in? Because I said I want someone to take a look at it because I'm just worried I just screwed up something or whatever the hell I did. I don't know. So they got me in. I could have gone in right away, but I'm like, I want to eat. And then I went there, so I never got my glasses adjusted. So I went in, and I saw the nurse, and she, you know, she felt around, she looked there, and she's like, nothing looks, you know, the concern, I guess, would be that something was ruptured, in which case I would have other things going on, like fever or other physical things that she could see. Her guess was that, because by then, you know, it was 11 o'clock in the 11 o'clock in the morning, and this happened at like 3, so 8 hours had passed by, and she said probably what happened was, you know, there's extra swelling because of that disturbance, and the swelling, like, pushed the implant a little bit higher, and that's why I can feel it. And once the swelling goes down, it should, you know, go back again. But to be on the safe side, she wanted to have me do an ultrasound. And I'm like, okay, I can do that. A cool thing that she did, I'll come in closer here. A cool thing that she did while I was there, because obviously she's looking at the ladies, and I had showered this morning, and the purple adhesive from the surgery is still there, and I can't scrub it off or any of that. I just let water flow over it. I can use my hands just gently on top, but I'm not gonna sit there like with a loofah, like scrubbing off the stuff. And I'm like, I see them, even before today, I'm like, I'm gonna see them in a week and a half for my 6-week follow-up, which is actually like more like 6.5-week follow-up. And they can take a look at it then and deal with it. But while I was there, she noticed that like the more you shower, the more that glue gets, when you get out of the shower, it gets dried up and it starts to crack. It doesn't hurt again because you can't feel anything. And it looks like it's like flaking off, and it'll flake off a little bit like against your bra and stuff, but like no way should you peel it off. You know, I just would just let it do what it's gonna do. If it comes off, it comes off. And if it doesn't, we'll deal with that when I see the doctor. So she said, you know, why don't we take off this adhesive? And I'm like, okay. It didn't hurt me at all. Actually, I did feel it on the very, very end, because it's not, you know, as you go around my boob more towards the side, I could feel that. And when I looked down, it wasn't purple anymore. And she's like, do you want to take a look? Because she was all excited with how they look. Again, they're all excited. I'm just like, whatever. So I looked in the mirror, and that was the first time I smiled, like looking at my boobs. Like nude, you know, looking at my boobs like with nothing on in the mirror, and I smiled. Because yeah, they had a scar, or have a scar, but it's far less like nasty looking than when you have the purple adhesive on it. The purple adhesive just reminds you that you were in surgery because it's purple, like there's marker on it and stuff, and now there's none of that. There's no markers left on it. It just looks like something happened to me. And I have 2 scars. I find scars tell stories, even though it's awful to have scars, but every scar you have on your body tells a story, you know, like tattoos, you know, they all have a story of why they're there. And these have, you know, a pretty short story. Ow. But they were flesh colored on the right side, more of the part that's healing faster, and then they were pink. And I'm like, flesh and pink are normal skin colors. So I felt good about it. And I looked at my boobs like, I know they're gonna shift over time. I know it takes like 3 to 6 months for them to look like what they're gonna look like. And I in that way, I do have the patience to just know what they look like now is not what they're gonna look like when they're done. And the nurse talked to me about tattooing also, because she's the one who does the tattoos. And oh, this is interesting. She also explained to me about the nipples, because I said I still hadn't decided about whether I want a 3-dimensional nipple tattooed on, or if I want like an actual like nipple, you know, put there. I haven't decided that yet, and I don't have to decide for 3 to 6 months. And again, pros and cons to both. But I thought that they had taken a piece of my tissue during surgery, and that was what they would use to make my nipple. And she's like, no, she said they would either, like at that time, all the tissue samples taken from me are like analyzed, done, close the book, gone. Which is good. I like closing chapters, move on. The nipple, she said, they take skin from the inside of your thigh. There's 2 ways. One is they take skin from the inside of your thigh and just kind of like roll it so it looks like a nipple, and then they attach it, however. The other thing, which I didn't realize they would do, and I'm like, oh, it sounds awful, yet sounds the most natural, which if I were going to have an external, if I were going to have an actual nipple put on there and not a 3-dimensional tattooed one, I don't think I'd want it for my leg. I don't have enough information, but just because it's more surgery to do something to your leg. And I personally would rather err on the side of less stuff done to me. But she said they would take this sounds cringeworthy, but they would take your boob. Again, it's numb, and I probably won't feel it at the time anyway. but they take it and they literally like squeeze and twist and twist and twist and twist until it looks like a nipple. And that's what they use. I don't know how they even get it to stay. I don't know, not my job, but that's what they do. It's like they take your boob and they just like go like, and they twist it. I don't have anything good on me to make an analogy other than my mask next to me. It's like they take it and they twist it. So as they're twisting, you know, it makes something that looks like a nipple, and that becomes your nipple. And then they tattoo it. And she said most often you have to have the tattoo done twice, like in not immediate succession, but like over a shorter period of time, because the coloring on your regular skin is different than the coloring on how it falls on scar tissue. And she said like she thinks it's cool. I mean, which is great because that's what she does for a living. But she's like, do you know what? She's like, you want to know where it's going to be? And like when I look down, like I can't. It doesn't mean much. If I looked head on, it would make more sense to me. And I'm sure that's going to be a part to digest, is like, you know, having boobs that look like they're 20-year-olds on a 50-year-old body, 49 and 3/4-year-old body. Because she's like, your nipples would be here, and I imagine they're going to be higher than what my old ones were. But she said the way it works is where the areola is, the scar where your incision is, the areola kind of just like nips the bottom of that. So it all blends together. And she said when you're physically looking at your boob, if I'm dating you and you're watching this years down the future, forget that I'm saying this, just stop listening. But for everybody else, when you're looking at the boob, your eyes would go towards the nipple. Your eyes would not immediately dart to wherever the scar is. So it's like an optical illusion, I guess, where your eyes would go there. So you don't focus so much on the fact that you have a scar that goes straight across. And again, some people have scars underneath. Mine is not. Okay, boyfriends can come back now. Okay, so she did that, whatever. There were a couple places where my scar is that were a little redder than she would have liked. So she put Aquaphor on, which I talked about weeks ago, whatever. They seem to love Aquaphor. So she wants me to put Aquaphor on twice a day. I have like 3 spots on my left side, just where it's a little bit more redder than usual. And then I wanted to show you these things. I think I flipped them out of my shirt last time, but this is what they look like in the package. They're actually abdominal pads, and they have a blue line on them. I know I showed them to you in a prior one, and I'm not taking them off today because I'm not in a happy place with my boobs right now because of what happened to them and my ultrasound, which was a huge trigger, which I'm going to talk about. So this is going to go long, heads up. And I picked up my tamoxifen today too. So this could be an hour. Just, you might want to pause, come back, or just follow along with the road or the ride, because I didn't get a pause. I just went from one thing to the next, and I was like, what? And then today was a lot. So I had the Aquaphor on, and then she said, you know, put these on. They're like kind of big gauze pads, but they're called abdominal pads. And the reason I'm showing you is because when I was there, she gave me a ton of these the last time I was there, because obviously you need 2. And if I'm using them for a week, I'm going to need, you know, what, 14 of them, well, 12 of them, because I have 2 on right now. And it just, I mean, again, this happened before, but like wearing black, you're not going to notice the bumps of me having this underneath. But I did order these on Amazon, like the exact same ones, same company. It's from Medline, and they come in boxes of 25, and it costs like $20. So like if you do need them and you realize that you're out, like don't freak out that you can't get them. I did find them on Amazon. Like I said, a pack of 25 was $20, and I think they had packs of 50 also. But when I was there today, I'm like, you know what? I said, can I just take a buttload of these so I don't have to, you know, I might even return the ones I probably actually won't. But I'll use these for the week. I'm sure there will be things that pop up because it's the second time I've needed to wear these for longer periods of time. So I just don't want you to worry that, like, if you're, you know, if you're told to use these and you're like, but she only gave me 3, you can get them online. But they take up like pretty much just one big rectangle. It's for your abs, but it also is the size of my boobs at least. So that's that. So she put me on there. They figured it out to get me down to the ultrasound room while I was there, because I'm like, I just want to get this taken care of. I don't really want to wait till Monday because I'm going to be all freaking out over the weekend. I did something to my boobs, whatever. I said, I just want to make sure everything's where it's supposed to be and I didn't screw something up. So I went, I mean, I've had ample ultrasounds. Went down to imaging and, I went down to imaging and they brought me in the room where you get changed. The jacket, the Johnny thing was blue. And I'm like, oh, because I usually go to the breast center to have my imaging done. And there you have either like mauve color or purple. And then I always think, well, which one's the unlucky color? This time it was blue. So I'm like, whatever, because, you know, I already know I have breast cancer, or had. There's no unlucky or lucky color. I already was tagged it, you know. Now I get to move on to the blue color. But because it's still COVID, there's different rules in place. And in the breast center at the other hospital I was at, they don't use lockers. Normally you put your stuff in a locker, but with COVID, they weren't using lockers. So I had like freaking 10 of these in my hand, and it's not easy to carry things, and I didn't know what to do. And she's like, put your stuff in the locker. It's so dumb. And I'm like, oh, okay. And that threw me off. Even having the key with me threw me off, because that's not normalcy in the COVID world anymore. And then I went to the ultrasound room. I've been in one a million times. Not literally, but a lot. And she said, lay down on the table. And I'm like, the table's flat. And I'm like, I can't do that. She's like, what's wrong? I'm like, I can't lay flat. I'm like, I don't know how much she knew about my history. I don't think she really knew anything about my stuff, because it was like last minute for me to go down there. And I said, I can't lay horizontal. I'm not at that place yet. And she goes, well, what if I put a pillow? I'm like, a pillow is not going to help. I said, can you, she goes, I can elevate the back. I said, please. I'm like, I'm at like a 45-degree angle right now. And I know you have to get in there to see stuff. I'm like, I'm just worried if I can probably get down flat, and my abs have been working really great, but I don't think I have the ab strength to get back up again. And if I have to have 2 people come in the room to lift me up, it's humiliating, and I don't want to do that. So she elevated the back up enough that it was awkward, but I still got down. And then she kept my right side covered, and it was funny because I'm like, I don't care if you look at my boobs. Everyone's been looking at them. I don't really care. She, like, you don't have to cover my right side. I just can't lay down. Like, that was just a pain. So she kept my right side covered, and I had my left arm out, and she says, all right, put your hand above your head. Because normally if you have a breast ultrasound, you put your hand above your head. And I'm like, I can't do that either. I said, I'm not trying to be difficult with you. I said, I don't have the range of motion. And she stopped and looked at my chart, and she said, oh, you had to do a double mastectomy. I'm like, yeah. I'm like, I'm not being difficult. I can't do these things. But I said, I want to make sure they get a good picture of what's going on. So if I have to suck it up, that's fine. But I don't want to pull something by moving too much. I'm like, I don't know what to do. I'm like, can you just work with me here to figure out like what the best thing is to do? Cuckoo clock goes off, and it always like stops me in my tracks. It just makes me smile. That's why I got a cuckoo clock. So she put the side railing up, and even that was just uncomfortable, and she put some towels on top of it, and I was able to at least like go to the side a little bit like this. And then even doing an ultrasound, I had an abdominal ultrasound scheduled because of my FMD, and they told me to push it back to November because to have an ultrasound wand on you, like moving around, It's a lot of manipulation, and you don't want a lot of manipulation. So I explained to her really quickly, like, what had happened, why I was there, and why I'm, you know, not able to do the things that she's asked me to do. So she figured it out and got me in a position that worked. And then she kept checking it with me. Does this hurt? Does this hurt? I'm like, no. But you can see the TV screen, whatever it's called, when they do the ultrasound. And I'm always curious because I find this stuff intriguing. So I turned over and I'm looking at it. And I'm like, I don't know what I'm looking at. You know, if I see my uterus on an ultrasound, aside from being pregnant, because I've had pelvic ones before, like, I know generally what I'm looking at. But I'm like, I've never seen an ultrasound of a boob that has nothing in it. And I thought she hadn't turned the machine on, or it was on. I thought she hadn't set, like, adjusted it right, because most of the screen was just black. And she's moving her thing around, you know, the whatever it's called, the thing around. I'm like pointing to her where the spot is that I feel. And I'm just looking at the screen and I'm like, it all just looks black. There's some tissue on the top that I see, but it's like very, very, very thin. So she couldn't quite get a good picture of it. She called the doctor in. The doctor, if he's watching this, because he asked me about, I somehow got in the topic of this vlog. I don't even know how that started. And he seemed very intrigued by the whole thing. I'm like, I talk about universal health care. And he's like, what's it called? So if he is on here, again, everyone's wearing masks, whatever, but he looked really young. I don't mean like 20 is young. I mean, he looked like he was like 15. And I joke, like, you know, because when I was like young, I looked much younger too. Like, people don't tell me I don't look my age now, which is flattering when you're like 50. When you're like 25 and people tell you that you look like you're 17, it's a little bit less flattering. But he looked like really, really, really young. Like Doogie Howser young. I'm like, he must be really smart. But he was looking at stuff, and a question that I hate being asked, oh my gosh, and I probably would not have the balls to have responded the way that I did, but he had a hard time finding it, and when I showed him, I'm like, it's right here, like right where my finger is, that's where the thing is that I can feel. And then I looked at the ultrasound, he found that spot, and I looked there, and I can see bump, 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 and I'm like, that bump, that's what I'm feeling. That's what it is. And it's the ripple of the implant. And I'm like, I get that that's the ripple. And he explained to me, and I could see it on the imaging, how it's really close to the layer of skin. And that's why I'm feeling it. So what he said, you know, I just want to make sure all the pieces are together. That's all I care about, you know. And he said something like, you know, it's not like there's a shelf there. And I'm like, from my understanding, there is a shelf there. So I'm still kind of confused. But then, you know, my nurse wasn't alarmed. The sonographer wasn't alarmed. And he wasn't alarmed. So I'm 70% not alarmed. I assume that my regular plastic surgeon will take a look at it probably on Monday. On a side note, there was a spot on my right side that I just happened to notice and to ask the nurse about. It looks almost like red. I can't see it well because it's like on my right side, like down here, pretty low on my breast. And it looks red, not like a rash, almost like stretch marks kind of. And I didn't think too much of it, but I thought, well, while I'm there, I said, I also have this. She was more concerned about that, which I didn't think it was a big deal. And she's like, if that gets redder, she's like, you have to call right away because she'd be worried about infection. And I don't know how long it's even been that way, but I can't see it really myself. I have to take a picture of it. So I'm planning on taking a picture of it every day for the next like week or so to, you know, just to track how it's doing. But just heads up, like what you think might not be a big deal, you know, might be, I don't know. So I have to keep an eye on that. But while the doctor in the ultrasound room is looking at that and showing me the bumps, whatever, and I can understand what it was, but I'm like, I want to understand to make sure that it's all where it's supposed to be. And he said, you know, it moves around. I'm like, I understand that. I just want to make sure that it's not moved to the point that it's going to I'm going to have this freaking bump forever, you know, and can we do something to just like stick it back in or shove it back or whatever? But he's like, it's just going to move over time. It takes a while to settle. And I know that that's true. Like my right side is significantly, well, not significant to me. Nobody else would notice that it's higher than my left side. My left side is much more settled. My right side, like my implant, I can feel it all the way up here. This side, I don't feel the implant till like down here. But what freaked me out, the first thing that freaked me out was when the sonographer left to get the doctor. She said to me, oh, I'll dim the lights for you so they're not so bright. And it was one of those movie moments where it's like, and I rewound back to the last time I was having a breast ultrasound. And it all came back. Because I'm like, the last time they told me that was when I was in the other hospital having the ultrasound done when they were doing the biopsy. And it was at that biopsy where she told me what I said to her at the end. And I said, you know, you probably can't tell anything. I said, but, you know, does everything look okay? Because I've been here for 7 hours and testing. And that was when she looked at me and she said, you're not going to die from this. And I'm like, wait, what? I thought she was going to tell me, like, I can't tell you anything because it's just a picture. We have to wait here for the doctors, whatever. And that was 2 days before my day one. Or the day before. I can't remember now. I had the ultrasound done and the doctor that was there reading the scans looked me in the eye and she said, you're not going to die from this. She said it's a 21st century. This is treatable. And I'm like, what are you saying to me? Like, this was just supposed to be a baseline. Like I've had ultrasounds before and they've always come back with happy news. Even like I thought I had miscarried when I had my older son. I hemorrhaged at 11 weeks with him and I thought I miscarried because I started bleeding profusely. You would just assume that you were miscarrying. And when I went to the ER and my placenta was separating from my uterine wall. But they did an ultrasound. And there you see Max bouncing around like, hey, happy as a clam. Which is just kind of how like life is with Max. Like there might be chaos going around and like he'd just be like in his little bubble like, hey. And he was fine. And I was on bed rest on and off throughout my pregnancy. But like I've never had an ultrasound where things were like, you know, I was the one to get the bad news. I mean, trust me, in my life I've had enough things with bad news, but like not from something like that. So when she said that, I'll turn the lights down, the whole situation just came back in my head and the doctor looked me square in the eye. And I remember she was this beautiful, I think she said she was from Jamaica, beautiful Jamaican woman with like, her skin was like, I mean, she had a mask on, whatever, but I remember her complexion was like perfect. Her skin was dark and her eyeshadow was like this gold color, which was such a nice contrast with her skin. It just went together well. And the other sonographer had like blue hair and the other one had really nice pink glasses. And I said, like, what nice bling you guys have when people are wearing masks and you kick things up with your eyeshadow and your glasses and your hair and whatever. But that whole day just came back. And when the doctor came, and the nurse said, she didn't ask if I was okay. She said something. I don't remember. But it was kind of like, are you okay? And I didn't say I was, that's not what she said. But my response would have been, I'm fine. But that's not what I said. But, you know, when you say you're fine, but you're really not fine, people just say they're fine, you know. I told her I was okay. Because I'm like, I'll be okay. And she's like, what's going on? And that was when I told her what I'd say to you, although I didn't cry as hard there that I did just now. And when the doctor came in and talked to me, the nurse or the sonographer she held my hand the whole time. And I'm like, I don't need you to hold my hand. I'm glad that you're doing that. Like, I put my big girl pants on pretty easily. And as much as I, like, ask for help, sometimes it's like I'm so used to being, like, tough. I don't know. She was holding my hand. And it just all came back. And the doctor said to me, he's like, so how far out are you? I'm like, this all just happened in July. I said, oh, that's how it came up about the vlog. I said, I think I'm on day 80 because I was thinking of these vlogs. I said, I think I'm on day 80. I said, it was July 9th. And he's like, wow. He's like, that's not that long ago. I'm like, no, it's not. It's just crazy how, you know, the pandemic happens and it throws your world for a loop, and then like you think that's bad, and then and this happens on top of that, and it's like, the fuck. So I did send a message to my plastic surgeon on the gateway, just asking if he was going to be reading the imaging too. I would ask about this thing on my arm, which is probably nothing, but I've been banging into stuff more lately. Like, I banged into the fridge twice. My arm, like, not my boob, but I had to take it easy this weekend. I've been doing too much again. I haven't really been doing a lot. It's just, you know, like going out for a normal breakfast, even if it's just me and my friend and there's nobody else there. Being normal right now is actually kind of exhausting. It's kind of a weird mindset. I'll put this in my lap before I forget. Can't finish or not talk about this. So yeah. And then when I went to leave, or when they were done, the doctor left, and he probably said other stuff I'm just not remembering right now. But I know I had to put the concoction together of my bra with the things on. And I'm like, now they have the gel thing on them from the ultrasound. And I said to them, like, I said to her, I just showered this morning. I'm like, it's such a project to shower. She did say I can start showering normally, like with actual soap on my boobs. And I'm like, woo! You know, not rubbing, just like gentle with soap. So that's a step. But I said I don't know how to get rid of all this goop. Because usually when I come home from ultrasounds, I noticed in the changing room even, there's wipes to get rid of the goop. But I don't know what's in the wipes. Like, I don't know if those wipes are made for people who have stitches in their boobs from having them sliced open. So I said to her, like, as much as I try to be tough, I can be very, obviously vulnerable. And I said to her, can you just please clean me up? Like, I just want to put my bra on and I just want to go home. And I don't have to want to worry that when I get home, I have to clean myself again because I don't know how, and it's exhausting and it hurts to shower. It doesn't hurt to shower. It's like the reaching. It's like I can't reach my triceps to clean. I can't clean the other side of my arm on either side. I just can't reach. And then people see me out and they're like, oh, like today I look nice. I have my nice shirt on and my skinny jeans on and cute little sandals, which I couldn't buckle. It took me forever to buckle them because I had to figure out how the hell to do a buckle on my shoe. I judge people based on their shoes, and now, like, I have these cute shoes, and I'm like, I can buckle one of them, and I'm like, I can't buckle the other one, and I'm like, I just want to buckle my goddamn shoe. I eventually figured it out, but it took me so long to get ready. Where was I? So she cleaned me up, and I said I had to put the Aquaphor back on. They gave me a bottle of Aquaphor to take with me, or a tube. And I asked her if she had a Q-tip, because I said my hands aren't clean enough to, like, put the Aquaphor on myself. and she didn't have any Q-tips. But she had a thing of like 4x4 gauze pads, and she gave me the whole pack. It was like this thick of gauze pads, so I could at least apply the Aquaphor back on. So I did that, and then when I went to the locker, now I know what it's like for short people, like using lockers. I went to the locker, and I had put my pile of these things on the top shelf in the locker because I didn't want to have to bend over to pick all of it up. But then in the meantime, it had all fallen backwards. And there was some other woman who was there. Oh, and when I walked back to the changing area, I hear the beeping. I want to do an episode 2 or a vlog, I don't want to call them episodes, about mammograms and ultrasounds and what they're like. For anyone who hasn't had one before, like ever. But there's a beeping. Oh, that sound. Beep, 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 beep. And you hear them say, inhale, hold your breath. Okay, release. And that's what it sounds like to have a mammogram done. And I look over and I see x-ray in use. And there's someone having a mammogram. And I'm like, I really hope that she gets good news. Because even at my last mammogram, they had no idea. They didn't see anything in the mammogram. The last time I had the mammogram done, I had a mammogram biopsy done, which sounds horrid. It really wasn't all that bad. But the only reason they saw stuff, the tumor was so small, and I had a mammogram biopsy done because it was so close to my nipple, and they had to like keep it still. So yeah, you're sitting in a mammogram machine for like 20 minutes while they put needles in your breasts. And weirdly, it didn't even hurt that much. The ultrasound one, for whatever reason, hurt more. I don't really get why. I think I would just had been poked and prodded for so long at that point. But they took the sample under the microscope and they could see the cancer cells dividing, like under the microscope. It's like they can physically see my cancer doing its thing. Like, how messed up is that? And cool and bizarre. That tumor was so small and like millimeters, and they could see it under a microscope, like dividing like crazy, because that's what cancer cells do. And that was how they first knew. Before I even had the ultrasound done, they knew that at least that they saw cancer in, down below by my nipple. So they knew before I even went in for the ultrasound that I had cancer. They could see the cancer cells, like, because they all met together and they all looked at them and they're like, come here, come here, come here. Anyway, I heard the mammogram sounds, god-awful sounds. On a weird good note, I don't think I ever have to have a mammogram again because I have no breast tissue. I'm not positive on that, but anyway, I went back to the locker room, or the room where the lockers are, and I got my clothes, and then I went to grab my pile of these, and they had slid back, and I'm like, I can't reach them. I can reach the top of that shelf, but I'm like, I can't reach back to get the rest of them, and I'm like, on my tippy toes looking over. And then there was a tall woman who was getting changed, and I asked her, I said, do you mind just grabbing those for me? And she's like, of course not. Asking for help. I'm doing a lot of that. And then I got changed and just spent more time than usual while I was getting changed. Putting the Aquaphor back on my scars and covering it up with the abdominal pads. And feeling like I took another, I felt so good the past 3 days, and I'd been off pain meds. Well, I can't even say 2 days because I took Tylenol earlier, because I'm in pain now. I don't know if it's from the phone or from all the hubbub. I'm in pain now. But I was off Tylenol for probably a day and a half, which was good. But putting these back on just made me feel like, I just took another 2 steps back. But, I guess cancer is not only a marathon, it's also a dance, Sometimes you take steps back. It's not horrible. It's stuff to, you know, keep an eye on, whatever. Nothing is perfect. Nothing goes totally as planned, clearly. So I went home, was totally exhausted, started making lunch, got so pooped. I'm starting to get back into my goth mode. Heads up. I didn't have time today to peel my nail polish off, which I know you're not supposed to do, but my friend Julie stopped by with new Color Street nails for me, and I have black ones, although they do have some white. I don't know if it's white or if it's glittery, whatever. It's black. It's actually a blue glitter on black. It looks really cool. It's like evil. So these will be gone, and I will have the black ones put on. Well, I'll put the black ones on this weekend, as long as these come off pretty easily. Because that's the mode I'm in right now, is Jen wearing black all the time is going to be back. And I have an appointment next week, a virtual appointment with the nurse from oncology to talk about tamoxifen. The prescription came in through Wegmans thing. I got a text that it was ready. And for this one, I'm like, normally I'd ask someone else to pick it up. And I'm like, nope, ownership. I need to be the one to pick it up. Yeah. So I went to Wegmans today with Barb after she got off work and picked them up. And there's no copay. That's cool. They're free. Whoop-de-doo. They're surprisingly inexpensive. Like, the retail price for these is $47.49 for a 2-month supply. There's other medications that are like thousands of dollars. I don't know. That's a whole other story. I'm not going to get into it because I'm at 15 minutes already, but the cost of medications like EpiPens are crazy expensive. And it's like, well, you need them so you don't die. Why can't those be zero? Isn't your life priceless? You know, apparently not. Ugh, anyway. But I went to the pharmacy. I have not been to a grocery store since surgery. I have 5 refills. It's tamoxifen, 20 milligrams. The ordering doctor is my oncologist, because I have an oncologist because I had breast cancer. I don't know what you call me. I haven't gotten the certificate of what I'm called. But what was cute, and I don't want you to see my address and stuff, but what was cute was this little sticker on it. Because a friend of mine is a pharmacist at there, and like these have non-child-proof caps on them so that they're easy for me to take on and off, which is great. And there's 2 bottles of them for whatever reason. But the sticker made me smile, so if you're watching, Stephanie, the sticker makes you smile. Because I'm pretty sure you put them on. Or put it on. It just makes, it's like this goofy, funky looking bear. And it just reminds me that, like, you know, Stephanie's always smiling. Like, she's just a happy person. It just made me smile that she's like there to cheer me up, because she knows my treatment plan more than anybody else does, because she's one of the pharmacists. Yeah. I'm not ready to take it yet. It's not a big deal if I wait till Wednesday. This is my next chapter. That was blank before, and now it's not blank. My next chapter is the big T. I'm just like staring at them. Tamoxifen citrate tablets. It says, don't use if you're breastfeeding. Well, I won't be breastfeeding. Can't do that without nipples, can ya? So part of my processing right now is literally just holding this in my hand. This is my next chapter. I'm not ready to flip the page yet. It says big T. I'm not ready to flip the page yet. I just have it in the back. I don't even want to open the back. I was mad before and like kind of shutting down from not doing anything. And now that I know what the next chapter is, like I don't want to do anything either. I'm gonna put that on the side. I also, while I was at Wegmans, I had gotten a gift card from someone, and I'm like, you know what? I'm going to impulse shop at Wegmans with the gift card. So it's the end of September. So I bought Halloween jack-o'-lantern cups. I bought 2 kinds of Ben & Jerry's ice creams. They were out of cookie dough, which is annoying, but whatever. I bought a candle. And other stuff I can't even remember. Apple cider. Just stuff, whatever I looked at, and I'm like, oh, cool. I want that. Cookies. None of those things help when you're constipated either. And tamoxifen also causes constipation. Yay. Let's pump up to 200 ounces of water a day. And I'm in pain. So the pain could be because I've been walking around a lot today and doing stuff. I did fall asleep on the couch for about an hour. I took Tylenol a little while ago because I couldn't take the pain anymore. And the pain feels like it's underneath. Because, I mean, obviously I'm numb, but the pain feels like it's under. And I don't know if it's because of the phone or if it's because of all the manipulation of people touching my boob today. You know, the ultrasound wand on my scar. I don't actually, probably wasn't even on my scar. I don't even know if it was on my scar. I don't know. I'm probably going to shower tomorrow anyway, although, like, it's a lot of energy to shower 2 days in a row. But I just feel like I want the ultrasound stuff off of me. Again, it's like that Silkwood moment where you just want to, like, shower and just get everything off of you. But I need some downtime. I'm going to have some ice cream while no one's here still. And then, sleep in tomorrow. Today was a really triggery day. I did a flat iron my hair, got rid of the blue. Oh, God, that hurts. I had to take it easy with the arms because that really, really hurt. All right, that was my triggering ultrasound day today. The crying is bound to happen. It's interesting that when you just don't know that it's going to happen and then something dumb like, I'll turn the lights down to help you, just like opens the floodgates. It is definitely a marathon, not a sprint. All right, see y'all tomorrow.